Good morning. My name is Dr. K. Lavanya. I'm an assistant professor in Department of Biochemistry, Mallareddy Institute of Medical Sciences. Today we are going to discuss about the tumor markers topic. The tumor marker, by definition, it is actually a substance that is produced by a tumor or a host in response to a tumor. This is useful for differentiate the tumor from the normal tissues. So tumor markers are found in blood, urine, other body fluids, and other tissues. They are measured quantitatively and quantitatively by chemical, immunological, or molecular diagnostic methods. Ideal tumor markers. These are the features of the ideal tumor markers. That is, they are highly sensitive, they're highly specific, 100% accurate in differentiating between a healthy individuals and the tumor patients. Differentiate neoplastic and non-neoplastic diseases. It shows positive correlation with tumor volume and extent. It predicts the early recurrence and have a prognostic value. It's detectable at early stage of a tumor. Its level should be preceding the neoplastic process. Short life short life to rapidly mirror the treatment schedules, measured easily, reliable, and cost effective. Uh, the tumor markers like alpha beta protein, it is seen in the hepatoma and germ cell tumors. Carcinoimmunogenic antigen, it is seen in colorectal cancer, gastrointestinal cancer, and lung cancer. CA125, that is carbohydrate antigen 125, is seen in ovarian cancer of epithelial origin, and tissue antigens, that is tissue polypeptide antigen, is seen in general cancer load, and alkaline phosphatase. Alkaline phosphatase is seen in bone tumors and also secondaries. Placental type ALP is seen in lung cancer and seminoma. Prostatic acid phosphatase is seen in prostate cancer. Prostatic specific antigen is seen in prostate cancer, and neuron-specific enolase is seen in nervous tissue cancers. So hormones and then metabolites. Beta HCG is seen in choriocarcinoma. Calcitonin is seen in medullary carcinoma of thyroid. ACTH is seen in lung or cell cancer. Vasoactive intestinal polypeptide. It is seen in amine precursor uptake decarboxylationova. Vinyl mandelic acid. Uh, it is seen in pheochromocytoma and neuroblastoma. And hydroxyindolistic acid is seen in parthenoid syndrome. The tissue catabolic products like hydroxyproline is seen in bone metastasis. Um, Serum proteins like immunoglobulins are seen in multiple myeloma. Ventrous protein also seen in the multiple myeloma. So alkaline phosphatase arises from the liver, bone, and placenta. Its normal value is 15 to 145 international units per liter. So ALP levels are raised in primary and secondary liver cancers. Its level will be helpful in evaluating metastatic cancer with bone or liver involvement. Its levels is increased in patients with osteoblastic lesions like in prostate cancer with bone metastasis. So prostate-specific antigen, PCA, PSA, it is a glycoprotein secreted by prostate, acinar, and ductal cells. It is normally secreted in seminal fluid where it is necessary for the liquefaction of seminal coagulum. Its normal value is less than 4 nanograms per liter. It is increased in prostate cancer. PSA exists in two forms in blood circulation. It's in preform and it's in complex form. Human chorionic ferrotrophins, HCG, synthesized by syncytocytotropoblastic cells in the placenta, used as a routine pregnancy test. HCG is a glycoprotein and it has its alpha and beta subunits. Alpha subunit is identical with FSH, TSH, and NH, and its beta subunit is identical to the HCG. It is increased in hydatid form bone, choriocarcinoma, and germ cell tumors. About 60% of the testicular cancers secrete HCG. Normal value of HCG is less than 20 international units per liter for males and non-pregnant women, and more than 10,000 It's more than 10,000 units, international units per liter, indicates of trophoblastic tumor. It also increased in non-seminematic germ cell tumors of testis and non-trophoblastic cancers like ovary, lung, breast, biliary, pancreatic, colorectal carcinoma, liver, and breast cancers. Other hormones and their metabolites, like ACTH, it's seen in small cell carcinoma of the lung and also Cushing syndrome. Prolactin is seen in pituitary adenoma. Vasoactive intestinal peptide, it is seen in pancreas, neuroblastoma, and bronchogenic carcinoma. Calcitonin is seen in medullary carcinoma of the thyroid, cancer of the lung, breast, kidney, and liver. The hormones like beta HCG, seen in trophoblastic and testicular cancers, it's also elevated in pregnancy, testicular failure. So beta HCG levels can be monitored, can be useful for diagnosis, monitoring the treatment, and determine its recurrence. So blood and urine sample and also CSF sample. CSF is the metastasis of brain. These samples can be collected to identify the beta HCG levels. Calcitonin, normally it should be less than 10 nanograms per ml. It is seen in a medullary carcinoma of the thyroid, bronchogenic carcinoma. It's elevated in other cancer, benign conditions like pernicious anemia and thyroiditis. So it is useful for diagnosis and monitoring the treatment and determine the recurrence. So blood can be taken as a sample. Oncofetal antigens are proteins produced during fetal life. Alpha-fetoprotein is synthesized in fetal yolk sac and hepatocytes, and to a lesser extent, GIT and kidney. Its molecular weight is 70,000 daltons. It is increased in hepatocellular carcinoma and germ cell carcinoma and pregnancy with neural tube defects. Its normal rate is less than 10 micrograms per liter. It is increased in many benign conditions like hepatic necrosis, hepatic parenchymal inflammation, cirrhosis, etc. If its level is more than 1,000 micrograms per liter, there is this indicator of cancer, and AFP correlates the stage and prognosis. So oncofetal antigen, that is AFP, it's raised, its reference range is 10 to 20 nanograms per liter. It is seen in cancers like hepatocellular carcinoma, germ cell tumor, germ cell cancer of ovaries and testes. It is also elevated in other benign conditions like pregnancy, benign liver disease. Blood can be taken as sample for determining the FP, and it's useful for diagnosis, monitoring the treatment, and determine the recurrence. CEE, that's carcinogenic embryonic carcinoma. It is elevated in the cancers like colorectal cancers, lung cancer, breast cancer, gastric cancer, pancreatic cancer, and the liver cancer. It's also elevated in benign conditions like hepatitis, COPD, colitis, pancreatitis, and also cigarette smokers. It's useful in monitoring the treatment and determine its occurrence. So blood can be taken as a sample here. The CA125, its reference range is less than 35 units per ml. It's mainly elevated in ovarian cancers. It's also seen in elevated in benign conditions like endometriosis, hepatitis, cirrhosis, and early pregnancy. It is helpful in diagnosis, monitoring, prognosis, the treatment, and determine the recurrence. It can be taken as a sample over here. And CA15, its reference range is less than 30. It is seen in elevated in cancers like breast carcinoma, adenocarcinoma of colon, lung, ovary, and pancreas. It is also elevated in benign conditions like cirrhosis, acute and chronic hepatitis, benign breast disease, SLE, and sarcoidosis. So it is useful in monitoring the treatment, disease progression, and metastasis of breast carcinoma. Sample of blood can be taken. CA27, it's elevated in cancers like breast adenocarcinoma of colon, lung, ovaries, and pancreas. So it's also elevated in other benign conditions like endometriosis, hepatitis, cirrhosis, and early pregnancy. It is useful for predicting early recurrence in the treatment, early recurrence in the treated breast patients. Blood can be used as a sample over here. And CA19, its normal range is less than 30 units per ml. It's elevated in the cancers like pancreatic, colorectal, and bile ducts. Elevated in other benign conditions like pancreatitis and inflammatory bowel disease. It is useful for staging and monitoring the treatment, disease treatment, and sample blood can be taken over here. So clinical implications. So tumor markers useful for screening, diagnosis, staging, prognosis, monitoring the treatment and treatments. So detection of tumor marker. You can there are various methods for detecting the tumor markers. Serologically by enzyme assays, immunologically by immunosorbent assay, ELISA and radioimmunoassay, and cytogenic analysis and FISH and compared to genomic hybridization. Genetic analysis is sequencing, reverse transcriptase PCR, HPLC, gel electrophoresis in immunochemistry. So tumor markers here in the lung cancer, CA125 and CEA are elevated, and in the liver cancer, alpha-fetoprotein is elevated, and the prostate cancer, PSA is elevated, and in the testicular cancer, AFP and HCG is elevated. In the breast cancer, CA125, CEA and HR2 is elevated, and in stomach cancer, CEA is elevated. In the colon cancer, CEA is also elevated. The chemotherapy. Chemotherapy is a treatment for the cancer patients. Surgery and radiotherapy are most effective methods to reduce the initial tumor load. These are prime modalities of treatment in the solid tumors. So chemotherapy is effective in leukemias, advanced lymphomas, choriocarcinoma, and widely disseminated malignancies. The effectiveness of cytotoxic drugs is directly proportional to the doubling time of tumors and inversely proportional to the size of the tumor. That is the number of cancer cells. The limitation of the cancer chemotherapy is that the rapidly dividing normal cells of the hematopoietic system, gastrointestinal tract, and hair follicles are also affected. So cancer therapy targets. Here the nucleotide synthesis. Nucleotide synthesis, the DNA, then RNA, then protein, and cell lining. All these areas, the cancer therapy mainly targets at the nucleotide synthesis. It also targets at the DNA synthesis, also targets at the cellular division. At nucleotide synthesis, methotrexate and 5-furyluracil, this will causes decrease in thymidine synthesis, and thiopurines, it will decrease the de novo purine synthesis, and hydroxyurea, it inhibits the ribonucleotide reductase. So DNA synthesis is inhibited by the drugs which target the DNA are alkylating agents like platinum compounds which affect the crossing of the DNA. Bleomycin causes DNA strand breakage. Anthracyclines and dactylmycin cause DNA intercalators. Etoposide inhibits the topoisomerase 2. Irinolectin or topotectin also affects the DNA, and cellular division. Vinca alkalides that inhibits the microtubule formation, and tannins inhibit the microtubule disassembly. Tumor lysis syndrome, the metabolic consequences that occur during cancer treatment. So this is the consequences which occur during cancer treatment. And they are like increased uric acid levels in the serum and urine, and acute renal failure, hyperkalemia, hyperphosphatemia, etc. So recombinant urate oxidase, this converts the uric acid to soluble analdehyde, which can be easily eliminated from the body. So So these can be like tumor lysis syndrome. It occurs when there is a rapid destruction of the tumor cells. There is a rapid destruction of the tumor cells by the anti-cancer drugs. They'll be releasing of much more amount of the intracellular substances into the circulation, and that is the increased levels of intracellular substance in circulation like uric acid, phosphate, proteins. So what happens when there is an increased uric acid level? They will be eliminated through the kidneys. Once they are accumulated in the kidneys, as in the case of tumor lysis syndrome, what happens? Most of the rapidly growing tumor cells are destroyed at a time. So what happens? What most of the intracellular components are released into circulation, and they get accumulated in the kidneys as excess amount of the uric acid is released, has to be eliminated from the kidney. But sometimes what happens? Excess of the uric acid gets accumulated into the kidneys and leads to renal failures and kidney related diseases. But when but in case of when we give uricase, rapuricase and other drugs, this causes the elimination of uric acid by converting it into allantoin. Allantoin is easily excreted from the kidneys. It can be easily eliminated in the urine.